So the informed consent is a practice of sharing information between a client and a counselor, but it's also a document that the client will sign, allowing them the opportunity to make choices about the care that they're going to be receiving. It also provides a little bit of protection for the counselor in that it's going to outline roles, expectations, and the compliance that they have with state and ethical guidelines. That was according to the APA Practice Directorate of 2024. When I went in and reviewed the Commonwealth of Virginia's regulatory regulations governing the practice of professional counseling and also the ACA Code of Ethics, I found that both of them were very similar. The ACA code seemed to be more thorough and easy to access that information and putting it all together than it was in the Virginia Code. The services that are offered are outlined, goals, techniques, and procedures. There's also sections for counselor qualifications, roles of technology, intended use of reports, confidentiality, fees and billing structure, clear information about their records, and input into the counseling plan. So that, along with some other definitely important information, is all included in that informed consent. There's also a lot of information in the ACA code about the multicultural way of making sure that everyone who is getting these services is able to understand what it is they're getting themselves into. I reviewed one from Healing Waters Counseling LLC. They had it broken down into several different sections. One was on their services, which gave their qualifications and experiences. The modality they used is cognitive behavioral therapy. They had a section on confidentiality and emergencies, which detailed more about where the client records would be kept, cases when confidentiality would be broken, and what to do in case of emergency, office hours, who to call, etc. It was interesting it didn't have that in that document, which I thought was could have been in there, would have been better. Financial insurance section, which was more about billing and how to submit to insurance, confidentiality of the credit card information storage, what to do in the event of non-payment, and that sort of thing. There was no fee structure that was attached to that. It was given separately. They had a section on the cancellation and rescheduling and no-show policy. Also a section on coordination of treatment. This was for if there were multiple healthcare providers for mental health, that they would release information and have a place for them to sign. It also gave a place to accept or deny that, and a place to provide that other provider's information. There was a section on privacy practices and client rights, indicated that they had given this to them in a separate document. Also, randomly there, they had a place for contact information for the client and asking for permission to be able to contact, and then also the best way to contact them, whether it's through email, telephone, or whatever. There was a section on consent for treatment of minors, which was basically just that, asking for consent to treat minors. And yeah, that was it. Several of the sections had signatures on them independently, and several did not. Overall, it was really good information. It was a little scattered and could have been more well organized. It seemed that a lot of important information was left to be given verbally, and it seems like when a client is coming in for services, they're kind of in a vulnerable place. So maybe that information would have been better to have actually been in the document, so they didn't have to go back and try to remember or find that later. There was actually no contact information at all on the document. There was the founder's name and address and the organization's address, or name, but no address, email, or phone number was listed on that form. It asked for signatures in about five different places on the form, but it didn't have a place for the counselor to sign, which was interesting. And a couple things it did not address were technology concerns, or anything concerning like diagnosis, testing, what would be done with that information, which I think is one of the big requirements ethically in both Virginia and ACA code. And the other thing that they didn't include were risks and benefits of services. So those were some things that I felt like could have been added that would have made it much more thorough. Thank you.